My name is Bobby Anand. I'm a specialist knee surgeon based around London and Surrey area. My practice is predominantly sports medicine, so 70% sports work, 30% arthroplasty work. I deal with a whole range of patients from amateur sport to elite professional sports, men and women. So MCL surgery has always been a challenge, and during my training we used a lot of autograft or donor graft, and although we got reasonable results with this often involved large incisions, bracing patients for a prolonged period of time, and it was a very painful, prolonged process to recover from MCL surgery. There's often a lot of muscle wasting associated with it. And it was a challenging operation that surgeons tended to avoid, and if you could get away without treating an MCL, you would do. And so my thinking evolved from some of my mentors who were gradually switching over to various forms of synthetics, but still the recovery was slow with the large incisions and the impact on the nerves on the medial side of the knee. And I've always been very anti-bracing. If we can get patients moving sooner, the results are always better. That's where my evolution to develop less traumatic ways of reconstructing the MCL came about, and I was in the process of doing this where I came, and this is about 5-6 years ago, when I came across the Infinity Lock range, and I thought this is perfect for what I'm thinking about doing. And so I did work with Xiros at this point. We did some basic mechanical testing to see if the concept of what I was looking at worked, and then we put that into clinical practice. And I've been doing it ever since for the last 6 years, and we've modified the technique and evolved it, and now we're at the stage where most MCL operations are 15-20 minute operations. The patients are not braced, and we can get them moving immediately, and what I've found as a result of that is there is a much lower rate of stiffness, barely have to do any manipulations. The return to sport has become much more predictable for patients, so I've been very pleased with the evolution. I think the benefits for the patient of using synthetics is that you're not taking their own tissue, and as that lowers your morbidity immediately. It's a strong, solid fixation to start with, so you can commence early mobilization, and that, particularly in relation to MCL surgery, is really important in terms of maintaining muscle control and keeping function. We've been recording all our results ever since we started, and so we've got very good data on how patients have been doing, and hopefully that will be published over the next 6 months or so. What I've found is the return to sport is a lot more predictable. The failure rates have been exceptionally low, and the complication rates on the whole have been exceptionally low compared to more traditional open techniques, and of using autografts where there is a higher rate of the grafts loosening. Surgery is all about being accurate and knowing your anatomy, so my advice is always to make sure your positioning of any synthetic or autograft you use is very precise. Understand the anatomy that you're dealing with, and ensure you get as close to isometry as possible with the ligaments that are isometric. So that would be my big tip. There is always a concern with synthetics about over-constraining. That's not really been an issue in my practice with MCL surgery, but it's something you should be conscious of when you start out using it. In my view, synthetics are very safe for extra-articular reconstructions. They've been used for a long time for PCL reconstructions, posterolateral reconstructions, and MCL surgery, so I really have no concerns at all in using it for those reconstructions. There is growing data that supports the use of synthetics for ACL reconstruction as well, but that is something, it'll be down to the individual surgeon to feel if it's appropriate for their practice. I think synthetics have had a bad name in the UK for some for very good reasons, some for not very good reasons. But what we're seeing with the new generation of synthetics and how we're applying them and how we're using them is the results are very good in general.